Okay, so good afternoon once again. So for today's session, we will be discussing the anaerobes of clinical importance. So what do you mean by anaerobe? So for this particular meeting, we will be discussing the following: the different types of anaerobic bacteria, including the serious and fatal intoxication, the endogenous bacteria. And as a medical technologist, do you know that anaerobic bacteria are actually very difficult to isolate? And since they are very difficult to isolate, it's quite important that we know the proper techniques of recovery and identifying them. Also, we will also be having the discussion on the procedures for identifying and testing their susceptibility and the possible treatment. So let us discuss first what are the important concepts of anaerobic bacteriology. So let us define first what do we mean by anaerobes. Okay. Um, when we say anaerobes, they are able to replicate in the absence of oxygen. Okay, so they have to replicate in the absence of oxygen, um, which means that oxygen could be harmful for them. Now, the air that we are breathing right now contains about 21% oxygen and only 0.04% carbon dioxide. So that's the composition of the air that we are breathing right now. So for obligate, there are two types of anaerobes. Some anaerobes are said to be obligate. So when we say obligate, they are actually strict. Okay, some are actually facultative. Okay, so when we say obligate, they are killed in the presence of oxygen almost immediately. Meaning to say, oxygen is toxic or harmful for them. Okay? Because the oxygen-free radicals will lead to their cell destruction, and they would only require low oxidation reduction or redox potential. So any amount of oxygen could be harmful for them, for the obligate or strict anaerobes. Okay. And then since a while ago I did mention that our our ambient air, the one that we are breathing right now, only contains about 0.04% carbon dioxide. And some anaerobes are also classified as capnophilic. So when we say capnophilic, they are carbon dioxide loving bacteria. And you need to increase CO2 level to around 5 to 10% and reduce the oxygen level by about 15%. So that would be possible by using this particular chamber. This is what you call the CO2 chamber. So you open the CO2 packet and the H2 packet, and that would actually cause the increase in carbon dioxide and reduction of oxygen. So this condition is still sufficient to allow aerobic organisms to replicate. But at least the amount of oxygen is reduced. Okay. Now, some organisms are classified as microaerophilic. So when we say microaerophilic, it means that the oxygen is reduced to 5% or less. So from 21% in the atmosphere, for microaerophilic, it would only require 5% oxygen. Okay, so that is for the microaerophilic organisms. This particular culture medium is called thioglycolate broth. So thioglycolate broth will support both aerobic and anaerobic organisms. So you would notice that obligate aerobes will grow at the surface, while obligate anaerobes will grow at the bottom. Microaerophilic would grow somewhere here, But for facultative anaerobes, such as this one, facultative anaerobes are aerobic by nature, but can still grow in the absence of oxygen. So they really need oxygen, sorry, but they can still even grow even in the absence of oxygen. So that is the reason why our definition of facultative anaerobe is that preferentially use oxygen as an electron acceptor if available, but can grow well without oxygen. So somehow they are adaptive. They prefer oxygen, but even without oxygen, they can still grow. Okay. How about the aerotolerant? So they are the moderate anaerobes. So in this particular case, oxygen steals electrons used in metabolism, and somehow it becomes bacteriostatic for them. So when you say aerotolerant anaerobes, they prefer not to have oxygen. But if oxygen is present, they can still grow. They can still tolerate. So this organism can still tolerate presence of oxygen. So that's why they are called aerotolerant. That's why they are called aerotolerant anaerobes. Okay, so I hope that's clear. Okay, so the different types of oxygen requirement. Okay, so these are some of the examples. Okay, so for example, mycobacteria are classified as obligate aerobic. Campylobacter is classified as microaerophilic. Enterobacteriaceae, such as the E. coli, they are classified as facultative anaerobes. And then aerotolerant anaerobes are mostly strains of Streptococci, Propionibacterium, which we will try to discuss later on. And then most Bacteroides and Clostridium, they are classified as obligate anaerobe. And Neisseria, which is an example of gram-negative bacteria, they are classified as capnophiles because they would require about 5 to 10% CO2 for growth. Okay, so these are the different classifications of organisms when it comes to oxygen requirement. Okay, now, why some organisms are anaerobes? So to answer this particular question, okay, some microorganisms are anaerobe because for them, oxygen will have a direct toxic effect. Meaning to say, meaning to say, oxygen can be harmful for them. Okay? And the reason why oxygen is harmful for them because they lack the enzyme system. They lack the enzyme system to convert the toxic forms of oxygen. So the question is, what are the toxic forms of oxygen? Okay, let me remind you that oxygen would be toxic for them, but not toxic for aerobic bacteria. Definitely not toxic for humans. We need oxygen. But this oxygen could be toxic for bacteria, and there are three main toxic forms of oxygen, such as the superoxide anion, the hydrogen peroxide, and the hydroxyl radical. Okay, so these are considered as the toxic form of oxygen. Meaning to say, this particular type of oxygen can be harmful for anaerobic bacteria. And if the bacteria are anaerobe, they should not be exposed to oxygen because once they are exposed to oxygen, then bacteria will not be able to grow. Okay? So, for those bacteria that are considered to be as aerobic or facultative anaerobic, so these bacteria have enzyme system. Okay? This enzyme system allows them to grow in the presence of oxygen. So because of the presence of the enzyme system, they are allowed to grow. So this particular enzyme system can break down toxic form of oxygen. So what are the examples? Examples are superoxide dismutase and catalase. Okay? So superoxide dismutase and catalase breaks down the toxic form of oxygen into a non-toxic form. So, anaerobic bacteria have no enzyme system. And since they do not have enzyme system, the toxic forms of oxygen remain toxic for them. Hence, hence they can't grow in the presence of oxygen because they lack the enzyme system. I hope that's clear. Okay, so if you have any question, you can always interrupt me. So I hope that's clear, ha? Anaerobic bacteria do not have the enzyme system. So where can we find anaerobic bacteria? Okay, so let us remember that there are actually two possible sources, exogenous and endogenous. Okay? So when we say exogenous, they are found outside the bodies of animals. And infections develop when we ingest or this particular bacteria have gone entry into our body. For example, Clostridium tetani is the causative agent of tetanus. We do not have Clostridium tetani inside our body, but for example, because of the wound that has been inflicted to us, Clostridium tetani may gain entry, and that is the reason why we get infected. So that is an example of exogenous source. But when we say endogenous source, it means that organisms exist inside the bodies of animal, and since they are naturally found inside the body of the animal, they become the source of infection. So examples are Bacteroides, Porphyromonas, Prevotella, Fusobacterium, and even some species of Clostridium, Propionibacterium, and some anaerobic cocci. Okay? So they exist inside the bodies of animal, and that particular animal became the source of infection. Okay? So these are the sources of anaerobic bacteria. So I hope that you'll be able to study your book because your book, particularly the one that is listed in chapter 22, would have the endogenous anaerobes commonly involved in human infection. So let me uh, please take note that whenever there are tables in our PowerPoint slide, I will not be discussing them one by one unless they are important or salient in our discussion. So if you want, you can actually screenshot it. Huwag niyo na isama sa screenshot. Can actually screenshot it and so that you'd be able to recall it. So we will be discussing the different kinds of infections, no, as we go along. So what's the most commonly isolated bacteria? anaerobic bacteria. So it says here, the most commonly isolated anaerobic bacteria, okay, in a particular hospital, okay, would be Bacteroides. But from blood culture, the most common is Propionibacterium. This is for blood culture. And they are mostly considered as contaminants. Okay, so which means that they're not really the one that causes the pathogenicity in the patients. Okay, so there are different anatomic sites of Propionibacterium. So we have our skin. So we can find Propionibacterium acnes, the one that can cause acne, and Peptostreptococcus. In respiratory tract, we have Prevotella, Porphyromonas, Fusobacterium, and some Anaerobic Oxide. For gastrointestinal tract, we have Bacteroides, Bifidobacterium, Clostridium, Eubacterium, Anaerobic Oxide. And for genitourinary tract, we also have Fusobacterium, Prevotella, Bacteroides, Lactobacillus, and some anaerobic cocci. So as you can see, they are found in different parts of our body. And since they are found in different parts of the body, it will be a challenge for our medical technologies on how to collect them without allowing them to be exposed in oxygen. Remember, once they are exposed to oxygen, then they will not be able to grow, and our diagnosis will not be successful. Okay? So it's very important that proper specimen collection is observed and proper culture media are also observed. Okay? So aside from those that were mentioned, we also have some of them are actually found in oral cavity. And those that are found in oral cavity may even cause periodontitis, and they may even cause um, dental caries. Okay. So do you know that for patients who are infected with anaerobic bacteria are actually more medically significant and dangerous as well. So there are factors that predispose patients to anaerobic infection. Number one is trauma to protective barriers, meaning to say, if there has been a wound that is inflicted. Number two is vascular stasis. This is common if there is ischemia. When you say ischemia, okay, that is actually due to low oxygen supply in blood vessel. And since there is a low oxygen supply, you prevent oxygen flow to the site, and that will actually cause this will allow proliferation of anaerobic bacteria. So anaerobic bacteria will actually proliferate because of this. And this will allow bacteria to gain entry and has a reduced environment, and that is actually a perfect for them to grow. When you say reduced environment, it means that that environment, okay, that particular environment has low oxygen. This usually happens in bite wounds, aspiration of flora into deep lungs, oral surgery, wound or burn with soil contamination. So, noteworthy to mention, if the patient has high blood sugar, so it will be very difficult for us to um, to heal the wound because of the high blood sugar. So, and then sometimes patients will develop ischemia, and that is a perfect formula for amputation because of gangrenous wound. Mapuputol talaga yung paa. Okay? So that is the reason why later on we will be discussing the different kinds of infections, and you really have to tell your loved ones that once they have wound and they are diabetic, then they really have to take care of it. Okay? Because they are at risk of getting amputation or being amputated. Okay? So these are the different virulence factors of anaerobic bacteria. So let me just mention some of them because we will also be discussing them as we go along. So we have the capsule, which prevents phagocytosis. We have the adherence factors that allow them to adhere to different surfaces. And then toxins. So we will be discussing different kinds of toxins. And then collagenases will degrade collagen, the connective tissue. Cytotoxin would be toxic to certain cells. DNases will destroy DNA. Enterotoxin will be toxic to our intestinal mucosa. Hemolysin, which we have already discussed in our previous module, will cause lysis of RBC, thereby liberating hemoglobin. Hyaluronidase is a spreading factor, which I have already mentioned in the previous module. And hyaluronidase will destroy the hyaluronic acid, the ground substance of many connective tissue. And then lipases will hydrolyze lipids. Neurotoxin will destroy, or this will either destroy or disrupt our nerve tissue. Phospholipases, and then proteases. Okay, so we will be mentioning and touching some of them as we go along our discussion. Okay, so these are the conditions that predisposes the animals or the humans to get anaerobic infection. First, if we have been bitten by humans or animals, imagine human bite can also be harmful. And then second, aspiration of oral contents into the lungs after vomiting, because there are some anaerobic bacteria in our oral cavity. Number three, tooth extraction, oral surgery, or traumatic puncture of the oral cavity, because this will liberate anaerobic bacteria. Number four is gastrointestinal tract surgery or traumatic puncture of the bowel. And then genital tract surgery or traumatic puncture of the genital tract. And lastly, introduction of soil into the wound, because soil may contain the spores of anaerobic bacteria, such as Clostridium tetani. Okay, so these are the conditions that will predispose individuals to anaerobic associated infections or diseases. Okay, so how do we know that someone is being infected already with anaerobic bacteria? First of all, the infection is in close proximity to a mucosal surface, such as the oral cavity or the genitourinary tract. Number two is the presence of foul odor, particularly if the wound is said to be gangrenous already. Presence of large quantity of gas, presence of black color and brick red fluorescence, and presence of sulfur granules. So this can be observed in the lab, and then this can be observed physically kapag meron kayong naamoy or nakita that infection in close proximity to mucosal surface. Okay, so most likely, the infection is anaerobic by nature. Okay, so let us now discuss the frequently associated or frequently encountered anaerobes and their association or associated diseases. So, anaerobic taxonomy, yes, they are both gram-negative and gram-positive. And some of them could be spore formers. So again, when you say spore formers, they have endospores. And for these gram-positive bacilli, The endospores could be terminally located. Pag sinabing terminally located, parang ganyan, terminally located. Or could also be swollen. Some of them could be centrally located. Some of them are non-spore formers, meaning to say they do not have endospores. And then the Gram-Stein reaction and the presence or absence of spores can be helpful in determining presumptive identification and the appropriate identification test to be performed. So that's the reason why that is also very important. So our first subtopic in today's meeting is about gram-positive spore-forming anaerobic bacilli. Okay, so gram-positive spore-forming anaerobic, and of course, when we talk about it, the most common species would be Clostridium. Okay? So, pag sinabi natin Clostridium, they are what? Anaerobic, and they are spore-forming. And what are the important species of Clostridium? So, we have Clostridium Perfringens. Common name, gas gangrene bacillus. So it is classified as the boxcar shaped gram-negative bacilli, and they can produce a double zone of hemolysis. So this particular double zone of hemolysis is sometimes known as the target hemolysis. Okay, so the double zone of hemolysis of Clostridium perfringens is sometimes known as the target hemolysis. And then we also have the Clostridium tetani. So Clostridium tetani is also known as the packhead bacillus because of the swollen and terminally located endospore. So there is a heavily swarming with terminal spores. And it is an example of toxigenic bacteria. And then we also have Clostridium septicum. Clostridium septicum, the spores located subterminally. So subterminally is somewhere here. Okay, so that is for Clostridium septicum. Okay, so here is an example of terminal spores. Kaya siya tinawag na packhead bacillus. Okay, of Clostridium tetani. And here's an example of subterminal spore. Another example of subterminal spore of Clostridium sordelli. Okay? So let's discuss about clinical infections. Okay, so they are mostly frequently encountered in exogenous infection, such as in wounds and ingesting toxins. Okay, some of them could be endogenous infection. Okay, so an example of endogenous infection is the one that is caused by Clostridium difficile. So Clostridium difficile will cause antibiotic-associated diarrhea, meaning to say, it is due to what? Too much antibiotics. Because of the too much antibiotics, too much drinking of antibiotics, a person with Clostridium difficile will have diarrhea, and at the same time, there would be pseudomembranous colitis, meaning to say, the intestine is inflamed. So Clostridium difficile is due to too much antibiotics, and too much antibiotics will destroy normal flora. It will destroy normal bacteria. So Clostridium difficile, therefore, would become opportunistic. So do you know how to treat someone who has overdose of antibiotics? Will you be treating that someone with another antibiotics if the reason for the diarrhea is too much antibiotics? Of course not. So in the United States, they have a treatment called stool culture, stool bank. What is a stool bank? If we have blood bank, we also have stool bank. Okay? So the treatment for Clostridium difficile is actually FTM, fecal transplant material, wherein we transplant patient with stool coming from a healthy donor. Stool, ha? Coming from a healthy donor. So the principle of that treatment is that we should allow these patients to have normal flora back. And the only way for us to have the normal flora back is by transplanting them with normal stool coming from healthy individuals, so that the normal flora or the normal microbiota will get back. Okay? And we also have the tetanus, gas gangrene, botulism, and other forms of food poisoning. So these are actually exogenous infections. Okay, so let's talk about Clostridium perfringens. So Clostridium perfringens can cause food poisoning. Okay, and there are several toxins that can be implicated in food poisoning, and one of them is the type A. The type A enterotoxin will cause diarrhea and cramps, and that particular diarrhea and cramps are usually mild and self-limiting, meaning to say it can heal by itself. But the one that is dangerous is the type C, because as you can see here, there is what you call Enteritis necroticans. Okay, so there would be necrosis, nabubulok ang intestine. Okay, enteritis, Enteritis necroticans is an acute onset of severe abdominal pain and diarrhea, which is most of the time bloody and may be accompanied by vomiting. It is followed by necrotic inflammation of the small intestines, and it will lead to bowel perforation. Without treatment, this can be fatal. Okay? So that is caused by the type C Clostridium perfringens. Okay? So usually, if there is a stormy fermentation of milk, do not drink that milk anymore, because Clostridium perfringens could be present there. Okay, so that's the reason why really have to be careful. And then let's talk about the botulism toxin. So Clostridium botulinum um, will cause foodborne botulism. And do you know that botulism is the world's most potent toxin? It is more potent than a cobra venom. And most of the time, Clostridium botulinum are isolated from canned goods because inside the can, there's no oxygen. And they would actually prefer living inside the can. So the common name of Clostridium botulinum is canned goods Bacillus. Okay, so that's the common name of Clostridium botulinum. So Clostridium botulinum will cause is actually due to ingestion of preformed botulinum toxin produced by Clostridium botulinum. It is an extremely potent neurotoxin, and small amount of food is enough to produce paralysis and death. Okay? So, because of the research, they also find out that there are some botulinum toxin that can also be beneficial to humans and can be used medically. So this kind of toxin is actually the botulinum toxin A. So the botulinum toxin A is the Botox. So baka siguro nababalitaan ninyo yung mga matatanda because may mga wrinkles sila, nagpapa-Botox na sila. That's actually true somehow because botulinum toxin can be used as a beauty enhancer. So nababanat yung skin. But it can also be used for the treatment of watery eye, chronic migraines, and even Parkinson's disease. Okay? There's another type of botulism, and that is the wound botulism. So wound botulism happens when the wound is contaminated with Clostridium botulinum spores. And the Clostridium botulinum spores will now start to produce the toxins. Okay, so what are the sources, symptoms, and different varieties? Sources of infection would be home canning and home cured meats. That is the reason why canned goods industries, okay, has what they call commercial sterilization, which I have already discussed during the prelims. If you remember our discussion on commercial sterilization, it is the application of enough heat to destroy the spores of Clostridium botulinum. Because symptoms could appear 2 hours or even 8 days later. But there's another important variety of botulism, and that is the infant botulism. So usually, infant will get the spores in contaminated honey. So it will colonize the colon and eventually it will produce toxins. Okay, so this is the infant botulism. So from honey that is contaminated. For adult botulism, it could be inhalation, the inhale. Iatrogenic means as a result of medical procedure. Or foodborne, when we say foodborne, it is usually when we eat canned goods. Okay, so what will happen if we get botulinum toxin? The botulinum toxin is an extremely potent neurotoxin that prevents the release of acetylcholine. What is acetylcholine? Acetylcholine is a neurotransmitter. So, for example, this is our neuromuscular junction. Whenever we are breathing, we need our muscles to contract, right? In order for us to breathe, our diaphragm is important. Okay, so everybody try to feel it. Inhale, exhale. Yeah, if you can do inhale, exhale, your lungs are actually expanding. Okay, as your diaphragm contracts, di ba? But for patients with Clostridium botulinum, the diaphragm cannot contract. You know why? Because the neuromuscular junction is filled with toxin that acetylcholine is not released. And if acetylcholine is not released, this will paralyze our diaphragm. And if our diaphragm is paralyzed, then we cannot breathe. Then we will die. Okay, so this type of paralysis is called soft paralysis. Or sometimes they call it the acute flaccid paralysis. Okay? So acute flaccid paralysis or soft paralysis. So this disease is associated with Clostridium botulinum. So this particular disease is associated with Clostridium botulinum. Okay. So let's talk about tetanus. This time, tetanus is caused by Clostridium tetani. And the main virulence factor, okay, is Tetanus plasmin. So Tetanus plasmin is a neurotoxin. And what is the function of Tetanus plasmin neurotoxin? What will be the action? It will inhibit the neuron by inhibiting a neurotransmitter or neuroinhibitor. Okay? So will inhibit the release of GABA, gamma aminobutyric acid. A while ago, the Clostridium botulinum toxin inhibits acetylcholine. This time, the tetanus toxin or the tetanus plasmin will inhibit GABA. And GABA is important for what? For muscle relaxation. So if GABA is inhibited, there is no muscle relaxation. And there would be continuous contraction of muscle. And this will result to rigid paralysis or yung hard paralysis. And this can result to death. Okay? So, if Clostridium perfringens causes soft paralysis, Clostridium tetani will cause rigid paralysis. So, that's the difference, ha? Clostridium perfringens, botulinum. I was actually preferring to botulinum. Clostridium botulinum causes soft paralysis. Clostridium tetani causes rigid paralysis. Clostridium botulinum inhibits acetylcholine. Clostridium tetani inhibits GABA. Okay? So symptoms, it begins about 7 days after the inoculation. So there would be rigidity of the jaw, neck, and lumbar region, difficulty in swallowing, sometimes even limbs as well. And Clostridium tetani is an example of toxigenic bacteria. And toxigenic bacteria can be prevented using the DTaP. Okay, diphtheria, tetanus, acellular pertussis, formerly known as the DPT toxoid. Okay, so what's the purpose of the vaccine? These vaccines are being given to neonates or to infants or to anyone who is at risk of getting tetanus. So if someone receives toxoid, and toxoid is actually an antigen, and toxoid means it is a weak toxin. If we receive weak toxin, our immune system will produce anti-toxin. And the next time around that we get exposed to the bacteria that is toxin production or capable of producing toxin, such as Clostridium tetani, we already have the anti-toxin, which will neutralize the harmful effects of the Clostridium tetani neurotoxin. So prevention is better than cure. So it's very important to immunize our children with BTAC so that they will not get tetanus in the future. Not only children, but even pregnant women or not necessarily pregnant, but those of women of childbearing age, so that the antibodies will also be transmitted or transferred, not transmitted, transferred to the neonate. Yan. So once we get tetanus, one of the signs of getting tetanus is the spasm of the back muscle. So we call it the opiscotonus. So incidentally, this child was born, okay, and his umbilical cord was actually cut by unsterilized material. And di ba, if you are not born in the hospital, you'll just be born in the house. There are higher risk of getting tetanus because even if you will be boiling the materials to cut the umbilical cord, that is not enough to kill Clostridium tetani. You know why? Clostridium tetani has endospores, and we know for a fact that endospores are not destroyed by mere boiling. To destroy the endospores, we need an autoclave. And do you think I have nothing against hilot? Do you think yung mga hilot, they have their own autoclave in their backpack? Of course not, right? So if we cannot autoclave our materials, then that materials can be at risk of having endospores. And worst case scenario, if the endospores are Clostridium tetani, then it can cause tetanus. Because tetanus, Clostridium, remember this guys, Clostridium tetani is present anywhere, everywhere, whenever there is a soil. So if your wound gets contaminated with soil, there is actually a greater chance of being infected with Clostridium tetani. So we want to have a very, if ever we have a wound, we need to debride it. We need to clean it every now and then, and we do not want any soil contamination. Because wherever there is soil, we expect that there is toxins of Clostridium tetani. So this one is Rhesus sardonicus. This is the spasm of the masseter muscles, and our masseter muscles are actually important for us to smile. But if you get infected with tetanus, you die smiling. Okay, so they call it the sardonic smile. Sardonic smile. Okay, so that's the spasm of the masseter muscle. So what's the mechanism? So neurotransmission is controlled by the balance between the excitatory and inhibitory neurotransmitters. So an example of inhibitory neurotransmitters are the gamma-aminobutyric acid or the GABA, and the other one is the glycine. It prevents the depolarization of the postsynaptic membrane and the conduction of electrical signal. So if we have toxins such as tetanus plasmin, it does not interfere with the production or storage of GABA, but it will interfere with the release of the GABA, particularly at the presynaptic left. So in the absence of inhibitory neurotransmitter, the excitation of neuroaxon is continuous and unrestrained until such time that we are paralyzed. Imagine yourself, your muscle contracts without relaxation. That's the that's the that's these are the things that's happening in tetanus. Muscle contracts without relaxation because the toxin inhibits the release of GABA, gamma aminobutyric acid. Okay, so I hope that's clear. The mechanism of activity of tetanospasmin. So, tetanospasmin is a neurotoxin. Okay, it is a form of neurotoxin that binds to receptor on nerve endings and prevent the release of neuroinhibitors responsible for regulating muscle contraction. So muscle contracts uncontrollably and rigid paralysis results. Again, Clostridium botulinum results to soft paralysis. Clostridium tetani, okay, Clostridium tetani results to rigid paralysis. Okay, now this time, we'll talk about myonecrosis. Okay, so by the way, Clostridium tetani and Clostridium botulinum, they are toxigenic bacteria. Okay, but this time, this is the bacteria that is known as the gas gangrene group because they can cause gas. As you can see here, okay? So, whenever the wound is contaminated from trauma or surgery. So, there are several species that can cause myonecrosis, but the most common is Clostridium perfringens. Okay? So, Clostridium perfringens is the most common bacteria that can cause myonecrosis. So, aside from perfringens, we have Histolyticum, Septicum, Noivy, and Bifermentans. It's painful and it's difficult because if we will not be amputating the area, it will cause sepsis and the patient may die. I know because personally my mom is diabetic. My mom was diabetic and her wound, okay, her foot um got contaminated. So yung wound niya na contaminate. So meron siyang diabetic foot. And until such time that they've decided to amputate it. Because if not, it would be very severe. So please, we do not want these things to happen to our loved ones again. So we have to remember that clean the wound properly, control the sugar, drink proper antibiotics. So do not allow it to get worsened. Okay? So if you know someone, because it's difficult to be, um, it's really difficult to be, if you have if to be an amputee, okay, your mobility would be limited. So you'll be a PWD. You'll have disability. So infection requires damage or dead tissue that supplies necessary anaerobic environment. Because if you have damaged tissue, there's ischemia. And what did I say about ischemia? There's no oxygen. And that is actually very ideal for anaerobic bacteria to grow. So tissue necrosis as a result of various toxins produced by the microorganisms. There's one particular treatment that we can use for myonecrosis. But before that, let's also discuss that Clostridium perfringens can grow, multiply, and release potent exotoxins. These particular exotoxins, particularly the alpha toxin, causes tissue necrosis and deeper invasion. Okay? It can cause death of the tissues that would require amputation. So, if I ask you, what kind of toxin causes death of the tissue in Clostridium perfringens? The answer is alpha toxin. So, there would be pain, swelling, and foul-smelling odor. Gas production, foul-smelling odor. So, treatment would be antibiotic and surgical debridement of necrotic tissue. And sometimes they are also using the hyperbaric oxygen chamber. Okay, so this chamber is rich in oxygen. And of course, allowing the patient to be inside the hyperbaric oxygen chamber will somehow discourage the growth of anaerobic bacteria. So this could be a possible treatment as well. So there are some anaerobic bacteria that can also cause bacteremia. So again, what is bacteremia? When we say bacteremia, we are referring to the presence of bacteria in the blood. So examples are Clostridium perfringens. This one is most commonly isolated from blood culture. And then Clostridium septicum. This is the marker organisms for malignancy of gastrointestinal tract. So in order for us to determine if there's already a cancer of gastrointestinal tract, then Clostridium septicum must be isolated. And then Clostridium tertium and bifurmentans. Okay, both of these are isolated from patients with various underlying diseases. So nonetheless, this bacteria can be isolated from the blood. Hence, the term is bacteremia. And I think a while ago, I did mention already about the antibiotic-associated diarrhea. Okay, so Clostridium difficile, which can cause pseudomembranous colitis. It is the necrosis of the colon tissue, and there would be bloody diarrhea. And I think I did mention to you also a while ago that the reason why it is the cause of antibiotic-associated diarrhea is that too much antibiotics destroys our normal flora, but it will not affect the Clostridium. So, the Clostridium will produce two types of toxins. Okay? Toxin A is also known as the enterotoxin, and the other virulence factor is called toxin B. So toxin B is an example of cytotoxin. Excuse me. Just adjusting my light. Okay. So this antibiotic-associated diarrhea is commonly transmitted as a nosocomial infection. So again, when we say nosocomial infection, we are referring to hospital-acquired infection. So this one is transferred among patients and hands of hospital personnel. So we call it the hospital-acquired infection. We do not generally culture for this pathogen, but it is important that we test for the toxin production. So ano ba yung toxins? Toxin A and toxin B. So apart the specific virulence strain, so do not forget this one, the B1, the NAP1, the B1, the NAP1, and the B1, the NAP1, and the 027. So the reason why we call them the virulent strain is because they are the ones that can produce larger amount of toxins A and B plus a third toxin, the binary toxin, and they have high level of resistance to fluoroquinolones. And as what I told you, we do not usually treat this bacteria with another antibiotic, but with FMT. Fecal material transplantation. Do you know in United States they have a stool bank, and you will also get paid if you donate stool. So how about it, no? So you will get paid if you donate stool. Okay, so that's a very nice, no? So, and there's also a prize for the biggest single donation of the day. Wow, imagine that, no? Ikaw yung may dalang isang stool ng palamig, no? Tapos bibigyan babayaran ka pa. So that is actually in Boston. Stool bank. So that is not yet actually available in our country sa Philippines. So matutuwa siguro yung Pinoy, no? Pag merong stool bank sa Pilipinas, tapos magdo-donate sila ng stool. Kasi siguro hindi masyadong common yung Clostridium difficile sa atin. But kung naging common, kasi wala tayong pambiling antibiotics. So pag naging common siguro to sa atin, tapos may stool bank, yung pihado, maraming magdo-donate. Kasi hindi katulad ng blood bank, bawal nang bayaran yung donor dito sa Pilipinas. But in stool bank, pwedeng bayaran yung donor sa United States. Walang ka-effort, magkakapera ka, no? Dala ka lang ng stool. Baka makita niyo yung mga classmates mo araw-araw nasa stool bank. Isang palamig na stool yung dala. Okay. Yan, so let's now proceed to another subtopic. So this time, we will be discussing gram-positive, non-spore-forming, anaerobic bacilli. So under this, we have the following. So we have the Actinomyces, the Bifidobacterium, and Propionibacterium. So all of these three can cause actinomycosis. And this is an example of actinomycosis. So when we say actinomycosis, it is a chronic granulomatous disease characterized by the sinus tract and fistulae that erupts to the surface and drain the pus. So may mga nana dito na lalabas. And the pus may contain sulfur granules, dense clumps of bacteria that can be colored. Yung pala yung actinomycosis. And it's actually in the skin, no? So chronic granulomatous disease characterized by sinus tracts. So pag sinabi natin sinus tract, so parang merong draining hole dito. Okay? So again, do not forget, this kind of bacteria may be caused by Bifidobacterium, Actinomyces, and Propionibacterium. So this is an example of Actinomyces israeli. And so a representative organism. And then we also have the Bacterial Vaginosis. Bacterial vaginosis can be caused by aerobic gram-positive bacilli, which I have discussed in other module, but this time, this is an example of anaerobic. So there is a shift in the endogenous microbiota of the vagina. So it results in decreased number of lactobacilli and overgrowth of endogenous anaerobic bacteria. So such as Mobilincus, Prevotella, Anaerobic Oxide, and Gardnerella vaginalis. I have discussed this in my previous module, and I did mention that Gardnerella vaginalis is characterized also by the presence of glue cells. So I hope you'll be able to find time in studying the other modules. But I think right now what you are prioritizing are those modules that are included in quiz number 1. But that's understandable naman. Okay. So let's talk about Lactobacillus. So Lactobacillus is a gram-positive, highly pleomorphic bacilli, and there are over 100 identified species, and we classify them as aerotolerant anaerobes, meaning to say they prefer not to have oxygen but can still tolerate the presence of oxygen. So they are widely distributed in nature and foods. I say food because milk such as Yakult has Lactobacilli shirota strain, okay, as part of the normal biota of human mouth, gastrointestinal tract, and female genital tract, because in female, they have Lactobacillus acidophilus. This is a very important vaginal flora. Lactobacillus acidophilus maintains the vaginal pH to be acidic, and it is the causative agent. It is commonly known as the Dodderlane's bacillus. Okay, so sometimes it could also be a contaminant in our culture. However, do you know that lactobacillus may also cause serious infection, such as bacteremia and endocarditis among immunocompromised, and endocarditis has a very high mortality rate, particularly among immunocompromised individuals. Okay, so this time, let's talk about the anaerobic gram-negative bacilli that are non-spore forming. So frequently isolated members are Bacteroides fragilis, Prevotella, Porphyromonas, and Fusobacterium. So we classify them as gram-negative anaerobic non-spore formers. So let's talk about the clinical infections. They can cause mixed infections, meaning to say no particular specific infections, and meaning to say they can be implicated in abscess under the mucosal surface, such as in oral cavity or prominent members of the GI biota, and some of them may be associated with peritoneal infection. So sa mga body cavities, so they may even cause peritoneal infections. Bacteroides fragilis is a most common isolate in blood culture, and some bacteria may even cause brain abscess. So they are part of the oral cavity but may go to the CNS, such as Prevotella, Porphyromonas, and Fusobacterium. So sa oral cavity lang sila. But eventually, they may even cause brain abscess. Okay, so another topic that we have for today is anaerobic cocci. So when we say anaerobic cocci, so this includes 5 genera, and the taxonomy of the genera is in flux. So examples are Peptostreptococcus, Anaerococcus, Finegoldia, Parvimonas, Peptoniphyllus. Okay, so these are the members of anaerobic cocci. But the most commonly implicated pathogens are the Veillonella. So one is the most common. So anaerobic cocci are weakly pathogenic, but they are found in a variety of infection. So they can cause brain abscess, aspiration pneumonia, lung abscess, gingivitis, and periodontitis. This is an example of periodontitis wherein the connective tissue that allows our tooth to be attached to the gums are actually infected, which is different from dental caries. Kasi yung dental caries, tooth decay lang. But ito mismo, yung connective tissue that connects, that cements the tooth to the bone. Di ba yung ang tooth natin connected sa bone? So yung connection part na yon is infected. And that is periodontitis. And most of the periodontal diseases are actually caused by anaerobic bacteria. So they are most often associated with polymicrobial infections, and evaluating the significance of anaerobic gram-positive cocci isolated in clinical specimen is very difficult. It's very difficult to isolate them. Okay, so let's talk about this time the specimen collection, transportation, and processing. So what are the acceptable specimen for anaerobic bacteriology? CNS, of course, CSF. We can utilize CSF, aspirated abscess materials, tissue from biopsy or autopsy. For dental or ear, nose, throat specimen, aspirated abscess material or biopsied tissues. So yung mga nana, pwede palang i-aspirate yon, ipadala sa laboratory. Localized abscess, meaning needle or syringe aspiration. So when you say abscess, we're referring to WBC or pus in high amount or quantity. Tagalog, madaming nana. That's abscess. Okay? The cubitus ulcer, aspirated pus. Sinus tract or draining wound, aspirated materials. Deep tissue or bone, we can obtain specimen from the surgery. Pulmonary, we can have an aspirate by direct lung puncture, or we can also collect pleural fluid by means of thoracentesis. Intra-abdominal, we can actually get aspirate from abscess or ascites fluid. Urinary tract, SPA or suprapubic bladder aspiration. For female genital tract, we can collect aspirate from loculated abscess. Okay, other specimen would be blood, bone marrow, synovial fluid. So as you can see, there are several specimens that may be acceptable for anaerobic bacteriology. And I say that anaerobic bacteriology is actually very more difficult than aerobic bacteriology. Again, it's much difficult to have them exposed to oxygen because our atmosphere naturally contains about 21% oxygen. These are unacceptable specimen. Throat swab, sputum, gingival swab, large bowel content, feces, voided urine, vaginal swab, surface swab. Why? Because these specimens are already exposed to oxygen. So since they are already exposed to oxygen, then it will not organize if and in our suspected bacteria are anaerobic, then they will not be able to grow. Okay, so we need proper education about which sites are appropriate for anaerobes. So includes collection of actual sites of infection, not just the surface. Because if you'll just be collecting the surface, most probably you'll not be able to isolate the bacteria because the surface is already exposed to oxygen. Okay? So requires rapid processing because the more whenever there is a delay, so they are actually faced with toxicity of the oxygen. And we do not want also drying of specimen. So the specimen types aspirates would need needles and syringes. Okay, less contamination, and whenever we are using syringe, we can also expel air. We can also expel air. Okay, and then best to inject in pras media. Ano bang ibig sabihin ng pras media? Pre-produced anaerobic sterilized media. Excuse me. Pre-reduced anaerobic media. So we just need to use few drop of pras and streak it for isolated colonies. So vitals, so ito yung ibig sabihin ng pre-reduced pras. Ibig sabihin, yung culture media na to is naturally made with low oxygen content. Okay? And then few drops of pras media and streak for isolated colonies. Okay? So we are, and this is the pras transport medium. So for example, nag-collect kayo and medyo malayo pa yung laboratory or you have to send it to the laboratory, then we need to use this one also. press transport medium. So swabs are not recommended and should only be used if under pre-reduced conditions. Yung tissue, kailangan malagay agad sa press medium or reduced transport medium katulad nito. And if it's blood, aseptic collection and subsequent inoculation in both anaerobic or aerobic blood culture bottles. So ito yung example ng anaerobic collection. So pagka-collect mo, ilalagay agad dito sa culture bottle. Tapos ito yung ilalagay sa incubator. And pag magpa-process na ng clinical samples, we have to use anaerobic chamber. So this is how the anaerobic chamber look like. So inside this chamber, there's no oxygen. So how would you be able to work if there's no oxygen? There is what you call glove boxes. So this is an example of glove boxes, and you'll be able to work and process the specimen. So once you remove the culture media outside this chamber, the bacteria will die. Because inside this chamber, there's no oxygen. So we can also use anaerobe jars or biobags. So biobags would allow working with anaerobes in an oxygen-free environment. So all tests can be done inside the chamber. All tests can be done inside the chamber and will reduce the likelihood of oxygen toxicity, killing relevant organisms. Okay? So these are the procedures performed on clinical specimen for recovery of anaerobic bacteria. First, we can do macroscopic examination of the specimen. We have to check. And then we prepare them for gram stain and inoculation of appropriate plated and tube media and anaerobic incubation of inoculated media. How do we know if it's an appropriate specimen? So kanina na-discuss na natin yung mga acceptable specimen. And if it's not appropriate, then you reject it. Okay? Was it submitted in an appropriate transport container or medium? Kapag na-isolate na, then kapag improper yung medium, then it should be rejected. Does the specimen have a foul odor? Qualification pala dapat mabaho. Kasi anaerobic bacteria, most of them have foul-smelling odor. Do they flourish when exposed to ultraviolet light? Well, for some bacteria, it's a requirement because for Pheromonas and Provetella, kailangan pala nila mag-glow in the dark. And then, necrotic tissue or exudate. So, yon. Does the specimen contain sulfur granules? So, ito yung mga kailangan natin i-check macroscopically. Okay? So, what do you mean by direct microscopic examination? So, pag sinabi natin direct microscopic examination, we are directly examining from clinical specimen. Okay. Pero kapag if we examine from culture media, we call it microscopic culture examination. So kapag nag-direct examination tayo, ibig sabihin, galing siya sa clinical specimen from the list of accepted clinical specimen that I have mentioned a while ago. So it helps rule in and rule out pathogens, establishes polymicrobial or monomicrobial infection. Ano ba yung ibig sabihin ng polymicrobial or monomicrobial infection? Yung ibig sabihin ng polymicrobial infection, one infection is caused by several species of bacteria. When we say monomicrobial infection, one infection is caused by just one kind or one species of bacteria. And sinabi kanina, majority of anaerobic culture are polymicrobial culture. Okay. Let's provide presumptive identification and it will aid us in selection of culture media. It can also determine the quality of specimen collected and can serve as a valuable quality control tool. Okay? So, direct microscopic examination of specimen is important, especially when we use methanol as fixative instead of heat. It is also important to recognize morphology that may indicate presumptive identification. So for example, we are suspecting Clostridium tetani, so dapat ang makita natin gram-positive bacilli. Or for example, we are suspecting gram-negative bacilli, fusobacteria, so dapat ang makita natin 10 gram-negative bacilli. Or for example, we are suspecting Bacteroides, Porphyromonas, or Prevotella. So dapat ang makita natin is a gram-negative Coccobacilli. So that's what we meant. That's what we meant by the importance of the direct microscopic examination. Now, after the direct microscopic examination, then it's about time that we choose the appropriate culture media. Take note, however, that when choosing the appropriate culture media, we have to take note that these culture media are actually difficult to grow. Okay? So, they are difficult to grow. And since they are difficult to grow, we need the additional supplement. Okay? So, this additional supplement can be in the form of vitamin K, hemine, and yeast extract. So CDC blood agar provides the best recovery. Okay? So yan. So these are examples of appropriate culture media. Okay, so I hope you'll be able to learn or to study table 22.8. So medyo mali ito, so that's the reason why I will not be discussing it, but it is actually found in the book. Okay, so this is another example of the pras-plated media. So pre-reduce na siya, and then we place it inside the chamber for less exposure to oxygen. And then specimens submitted for anaerobes are also requested for aerobic culture. Meaning to say, kapag yung doctor nag-send ng suspected specimen in the lab, okay, the doctor would be requesting it for both aerobic and anaerobic. So the doctor would be requesting for both aerobic and anaerobic. Okay? And for example, it is a wound. Yung wound na to contains several bacteria. So for example, E. coli, hindi naman siya anaerobic. So this one is aerobic or facultative. Tapos yung Bacteroides, anaerobic. Tapos yung Prevotella, anaerobic. Yung Staphylococcus aureus, aerobic. Yung Peptostreptococcus, it is anaerobic. So, yung isang wound, dalawang klase ng bacteria siya meron. Meaning to say, since dalawang klaseng bacteria siya meron, aerobic and anaerobic, kailangan yung cultural methods mo, dalawang klase din. So this is the aerobic cultural method and this is the anaerobic cultural method. So sa aerobic cultural method, you can use sheep's blood agar, chocolate agar, McConkey, or phenylethyl alcohol. So ito, makaka-isolate ka ng E. coli and S. aureus. Sa chocolate agar, E. coli and S. aureus. Sa McConkey, E. coli. Sa phenylethyl alcohol, S. aureus lang. Pero kung anaerobic naman, you can use Brucella blood agar. Ang ibig sabihin ng brew dito, hindi Brucella. So, all 5 organisms may be isolated. Tapos, yung pigmented species of Prevotella can be isolated also in PEA and CNA. Pero yung BBE and KVLB would be exclusive for anaerobic. So, ano yung BBE? Bacteroides, bile esculin. Ano yung KVLB? Kanamycin, vancomycin, lake blood agar. So, ito yung mga anaerobic culture media. Okay? Ito yung mga examples ng anaerobic culture media. So, again, the basic component of anaerobic chamber. So, ibig sabihin sa loob nito, sa loob nitong chamber na to, this contains 5 to 10%. This contains 5 to 10% hydrogen gas, 5 to 10% CO2, and then 80 to 90% nitrogen gas. Kapag yung tao ba kinulong mo rito, mabubuhay? Wala. Kasi tayo, naka-expose tayo sa 21% na oxygen. So, yung loob nito, walang oxygen. Okay? So, kailangan din natin ng catalyst dito sa loob ng chamber. So, the catalyst consists of palladium-coated aluminum pellets. So, it removes any residual oxygen. Kung meron mang makalusot na oxygen, aalisin siya ng catalyst na palladium-coated alumina pellets. That's the name of the catalyst. Okay? Ano purpose ng catalyst? It enhances the reduction of oxygen. So, the anaerobic chambers needs a desiccant. We need to remove excess water. Why? Absorbs excess water produced when catalyst removes oxygen to form water. Kasi water itself contains oxygen. So, kailangan din siya mawala. And then there is also an indicator. Okay? Colorless when no oxygen is present. Pero magiging blue or pink siya when oxygen is present. So kapag methylene blue yung indicator natin, pag naging blue, ibig sabihin may oxygen. Kapag reazurin dye naman, yung indicator natin, reazurin dye, magiging pink kapag present yung oxygen. So depende kung ano yung gagamitin. Pero kadalasan, ito yung ginagamit. Okay, so ayan yung example ng anaerobic chamber. So ito tent, medyo mas mura to, tent lang to. Ito talaga yung yung chamber talaga na mas mahal. Okay, so nonetheless, yung loob nito, ibig sabihin walang oxygen. Ito yung glove box, oh. So, yung kamay mo lang yung yung kamay mo lang yung ipapasok mo para makapag-work ka. Okay? Huwag mo ipapasok yung ulo mo, ha? Baka ipasok mo yung ulo mo. Kasi pag pinasok mo yung ulo mo, di ka makakahinga kasi sa loob niyan, walang oxygen. Tsaka paano ka makapag-work, di ba? Oh, so, baka kasi yung ibang medtech, yung iba sa inyo, mukhang grade school pa lang, kasya kayo sa loob niyan. Okay? Yung mga hindi pinagpala ng height, kasya kayo sa loob niyan. So, pero hindi ibig sabihin papasok kayo sa loob. Okay? Ano lang yung papasok sa glove box compartment? Dapat ang papasok lang sa glove box compartment is yung yung kamay ninyo so that you'll be able to work. So sa loob nito walang oxygen. Yan. Because at the same time safe pa kayo. Kasi 'di ba merong glass or acrylic chamber to, but usually glass 'yan. So hindi rin kayo mako-contaminate ng bacteria. Ayan. Unfortunately, we do not have this in the lab. Ang meron lang tayo yung biosafety cabinet. Because it's really expensive. And syempre, we will not allow our students to be exposed to anaerobic bacteria. because anaerobic bacteria are actually more dangerous than the aerobic bacteria, although they are also dangerous as well. But most of the anaerobic bacteria are highly pathogenic. Alternative, kung walang, kung hindi mayaman yung lab, ano yung alternative? So, unsuitable nitrogen gas holding system, a jar, box, or small chamber. It's important not to keep inoculated plates out at a room temperature for more than an hour. Otherwise, bacteria will die. Yan. So, these are the alternative. Okay? The anaerobic jar or the anoxomat system, which removes oxygen as well. Yan. So, an anaerobic bag. So, bubuksan mo lang yung palladium that serves as a catalyst. Tapos, meron din siyang indicator. Okay, anaerobic bag. Okay, so, what are the procedures for identifying anaerobic isolates? We can have presumptive identification. So when we say presumptive identification, this is based on colony morphology. And then we can have definitive identification. This is based on the commercially available system. And then it could be a semi-automated machine, katulad ng BBL Crystal ID, Vitec, or meron ding commercially available biochemical-based system, and then cellular fatty acid analysis. Pero ito yung pinakamaganda. This is the gold standard. Kasi this is the molecular method. And then the Malditoff MS. So these are the options for identifying anaerobic bacteria. Okay, so let's talk about preliminary procedures. So when to examine primary plates? Okay. Emphasis shift from full identification of all anaerobe present to rapid presumptive identification of the most commonly isolated anaerobe. So dito, it's very important to take note that examination of primary plates depends on the incubation conditions. So if we are using anaerobic jar, plates can be examined at any time. But if you are using jar, bags, or pouches, you have to incubate it for 48 hours. Bakit? Kasi yung jars and bags, you need to open it. Kapag inopen mo na to, ma-expose na siya sa oxygen. Unlike kapag nasa anaerobic chamber, you can examine it anytime. So, ipapasok mo lang yung kamay mo sa glove box compartment and then check the plates. Okay? Unlike if the plates are in jars, bags, and pouches, you have to wait for 48 hours. And what do we need to look for? Okay? We need to look for foul odor when opening anaerobic jar or bag. And then we also have to look for colonial morphology of anaerobic agar plates, but not on aerobic culture plates. So usually, kailangan natin tingnan yung gram stain for unique morphology. So for example, if it's Clostridium tetani, you would expect to have a swollen spores if it's a Clostridium tetani. And then, there should be a good growth on bile esquilene agar. So ito yung example ng Bacteroides bile esquilene agar. So kapag merong growth na ganito, that's okay. Tapos kapag meron double zone of hemolysis and blood agar, that's another good indicator. Particularly if you are actually suspecting Clostridium Perfringens. And brick red fluorescence on vancomycin clay blood agar. Yeah, so this is processing of colonies. So I think I will just stop here for para hindi tayo mabitin. So I will just stop here for part 1. So for those of you who are watching, please refer to part 2 for the continuation of our discussion.